we will discuss the menstrual cycle. So we will cover these competencies. Describe the uterine changes occurring during menstrual cycle. Then describe the synchrony between ovarian and menstrual cycle. Now, menstrual cycle is the process of discharge of blood and other things that from the vagina of a woman every month from puberty to menopause, excluding pregnancy. It is a natural periodical process that brings changes in the female reproductive system, which is responsible for the pregnancy. Now, this menstrual cycle it includes changes that occur in the ovary and the uterine wall simultaneously as a result of the changes in the level of the hormones in the blood. Now, the two significant events occur within the female reproductive organs. First is the release of single ovum from one of the ovaries, we call it as ovarian cycle. That is happening, which is leading into the release of ovum from the Graafian follicle. Second is that the uterine endometrium is prepared for the plantation of a fertilized ovum. Now, if the ovum is not fertilized, the lining is released, which results in menstruation and also called as menses. Now, this menstrual flow consists of blood from broken capillaries, secretions from endometrial glands, endometrial cells, as well as an unfertilized ovum. The average duration of this period is 3 to 5 days but may range from 2 to 7 days in some women. Normal estimated blood loss is on an average 35 ml of blood. Then menstrual cycle is taken to begin with the onset of menstrual bleeding and ends just before the next menstruation. So that is the menstrual cycle. Then onset of menstruation is called as menarche, which is taking place at 10 to 12 years. Now, before starting with the menstrual cycle, so first we will discuss the structure of uterus, which is consisting of perimetrium, myometrium, and endometrium. Now, perimetrium is the outermost layer made up of peritoneum and the connective tissue. Myometrium, the main thickness of the wall of the uterus, that is made up of smooth muscles. Then endometrium, it is the innermost which is corresponding to the mucous membrane. So this is the innermost layer. So during menstrual cycle, changes occur in this layer basically in the endometrium. Now, what are the constituents of endometrium? Now, this is the endometrium, the epithelium lining of the surface of the endometrium, that is one. Then stroma fills the interval between epithelium and myometrium. It contains numerous glands called as uterine glands. Then arteries supplying the endometriums tend to run vertically towards the surface. Now you can see they are running towards the surface. Some of them run spirally and supply the whole thickness of the endometrium, while others they remain straight and are confined to the basal portion only. All these structures undergo changes during menstrual cycle. So the changes they are happening in this endometrium during menstrual cycle. Now the stages of menstrual cycle is menstruation, the flow of blood through vagina, then follicular phase in which the ovum is released from this portion of the ovaries. So then is the ovulation, it happens and reaching to the fallopian tube, passing through the fallopian tube, reaching to the uterus. Then last is the luteal phase. So next fate it depends upon whether the ovum is fertilized or not. So that fate is there. But in menstrual cycle we will discuss if the ovum is not fertilized. Now, what are the phases of menstrual cycle? So these are the four phases you can see, that is menstrual, post-menstrual, proliferative and secretory or premenstrual. Now this post-menstrual and most of the proliferative phases are under the influence of estrogen hormone, which is produced by the developing follicles in the ovary. Therefore this period or this you can say the span or this part of the menstrual cycle is known as the follicular phase. Now during the development of the follicle, what is happening in that process? The ovulation it happens, formation of the corpus luteum is there, then secretion of the progesterone happen. Now after that, during the second half of the menstrual cycle, the progesterone along with the estrogen produce cyclical changes. Corpus luteum influences these changes, hence this half is called as luteal phase. So this is the luteal phase, this is the follicular phase. Just before the onset of the bleeding or beginning of the menstrual period, so there is lowering of both the progesterone and estrogen, and it is because of this withdrawal bleeding the menstruation it happens. Now we will discuss the changes seen in endometrium. We call them as uterine changes. So we will discuss the change in the thickness, shape of gland, lining epithelium, stroma and arteries. Now you know the structure of endometrium. Now it has lining epithelium, it has glands, then it has the thickness, then stroma is filling this gap between the epithelium and myometrium, and the arteries are running in this stroma or endometrium. So we will discuss the changes. First, in the thickness. Now endometrium progressively increases in thickness. In post-menstrual phase, it is zero point 0.5 to 1 millimeter. In proliferative phase, it is 2 to 3 millimeter, and in secretory phase, it is 5 to 7 millimeter thick. So these are the changes which are happening during the menstrual cycle. So again, this is the diagram. These diagrams are taken from your standard books. Now coming to the shape of gland. Now the uterine gland grow in length. So all the uterine glands which are present in this, they grow in length and diameter. Initially they are straight. You can see in the diagram. And when the endometrium thickening is about zero point 0.5 to 1 millimeter, in postmenstrual state, they are straight. Now gradually they become convoluted. You can see the convolution. Then the sawtooth appearance it happens. The most basal part it remain the tubular and do not undergo changes. So these are the changes which are happening in the shape of gland. Then is lining epithelium. Now in postmenstrual phase, once the menstruation that is over, the cells are cuboidal. So this is postmenstrual phase. In proliferative phase, the cells are columnar. Glycogen accumulate in the basal portion of the epithelial cells, pushing the nucleus towards the lumen. In secretory phase, what is happening? The apical portion of the cell is shed off as part of the secretion. The cells again become cuboidal with irregular margin towards the lumen. So again, this phase is coming in post-menstrual phase. Now in stroma, the stroma is divided into three layers, that is stratum compactum, stratum spongiosum, and stratum basale. In post-menstrual phase, the cells are uniformly distributed and are compactly arranged. In proliferative phase, increase in the thickness of the endometrium it happens. The superficial part of the stroma it remains compact, but part surrounding the bodies of the uterine gland it becomes spongy, and the basal portion is the stratum basale. In secretory phase, what is happening? Three layers are better defined. Now this is the secretory endometrium, in which the stratum compactum, stratum spongiosum, and stratum basale they are well defined. The endometrium becomes soft and edematous because of the fluid secreted by the uterine glands. So this is again the diagram showing this. You can see. So late secretory phase, this is how it is. All the layers they are well defined. So endometrium at the end of menstruation, what is happening? The very less stroma is just lining the epithelium. The cells are cuboidal, and later on the growth of the epithelium it happens, and they line the surface of the cavity too. Now coming to the arteries. In postmenstrual phase they are small. In proliferative phase they grow in length. In secretory phase, arteries supplying the superficial 2/3 portion of the endometrium become very tortuous and are called as spiral arteries. The arteries in the basal portion they remain straight and short. Now after this secretory phase, towards the end of secretory phase, the endometrium is thick, soft, and richly supplied with blood. Now, the secretory activity of the uterine gland makes the endometrium soft, as well as it provides the nutrition to the embryo if pregnancy it occurs. Now, in absence of pregnancy, following abortive changes occur. What happens? That is, superficial part of the endometrium, that is stratum compactum and spongiosum, are shed off accompanied by menstrual bleeding. A few hours before bleeding, what is happening? What is the mechanism which is functioning basically? Uh, Spiral arteries are contracted, stopping the flow of blood to the superficial part of the endometrium, causing ischemia, leading to degeneration of the endometrium, and also damaging the walls of the vessels. Now, what is next then? Subsequently, when the arteries they relax, the blood again flows into the endometrium. It leaks out through the damaged blood vessels. This leaking blood causes the shedding of the endometrium in parts, and the blood along with the shreds of the endometrium they flows out through vagina. So by the end of menstruation, the endometrium is 0 0.5 millimeter, consisting of stratum basale with basal portion of the uterine glands. So this is the fate. Now coming to the time of ovulation in 28 days cycle is in the middle of the cycle is 14th day. The period between ovulation and the next menstrual cycle is constant at about 14 days. You can see in 28-day cycle, 30-day cycle, and 26-day cycle. But the time of ovulation does not have constant relationship with the preceding menstruation. So if it is 40, 30-day cycle, it is the 14 uh, days period, it will become 16. So that is not constant, but the period between ovulation and next menstrual cycle, that is constant, that is about 14 days. If the woman has irregular periods, then it is difficult to predict the date of next ovulation. Now, this is the ovarian cycle, because we have to discuss the relationship between the uterine cycle and ovarian cycle. So, these are the changes which are happening in the ovary. The cyclical changes in the ovary during 28 days of reproductive cycle, resulting in the formation of single mature ovum, which includes the follicular development, ovulation, and regression of corpus luteum. So, this ovarian cycle is under the control of these glands, that is starting from the hypothalamus, the signal is coming to the pituitary gland, then to the ovaries. So that is known as the hypothalamic pituitary ovarian axis. Now, what is happening next to is in the development of the follicle, the primordial follicle is formed, primary follicle is formed. I have discussed this thing in my previous lectures, so you can go through that. So, what is happening in primordial follicle? The cells, stromal cells, they are flattened because they are going to form the follicle. We call those stromal cells as follicular cells. In primary follicle, they become cuboidal, and the appearance of the zona pellucida it happens. Then what happened next to it, that the follicular cells, they multiply to form the membrana granulosa. The cells, now they are called as granulosa cells, they are polyhedral cells, and the follicle is given the name secondary follicle. Now these granulosa cells, that secrete the secretions. Now fluid filled cavity, it appears in the membrana granulosa. Now it is called as tertiary or antral follicle. Now, as the cavity enlarges, wall of the follicle made up of granulosa cells become thin. Oocyte is eccentrically placed with some granulosa cells called as cumulus euphoricus towards the cavity, and some cells are attaching the ovum to the wall by the discus proligerus. Layers of cells immediately surrounding the oocyte and zona pellucida are called as corona radiata cells. So stromal cells surrounding the follicle condense. Rest of the stromal cells which are present over here, they are condensed to form the theca interna. Outer fibrous layer is the theca externa. Now follicle is called as matured Graafian follicle, and theca interna, it secretes the estrogen. Now ovulation is happening on the 14th day plus minus 1. So shedding of the ovum from the ovary is called as the process of ovulation. Initially follicle is small. As the growth occurs, it reaches the surface of the ovary and produces a bulge. Ultimately follicle rupture and ovum is released. At the time of ovulation, it is secondary oocyte in metaphase. We have already discussed these slides in previous lectures. Now released oocyte is picked up by the fimbriated end of the fallopian tube. If it is fertilized, then it completes its second meiotic division, otherwise it degenerates in 24 hours. So these are the stages. You can see in first 13 days what is happening. So that is the follicular phase. Follicle is developing. On 14th day ovulation is happening, and after that the luteal phase it starts. Now this is the structure basically. The stromal cells or follicular cells surrounding the ovum is known as corona radiata. So this is the large cell measuring more than 100 micrometer, and in this the zona pellucida is present. Nuclear membrane is not there because spindle is are there, so nuclear membrane is dissolved. Now between the cell membrane and the zona pellucida, this is vitelline membrane. Basically this cell membrane is given the name vitelline membrane, and the space between this is given the name perivitelline space, which is having the first polar body. So this is the structure of the ovum. Now what is the aim of the discussion of that ovarian cycle in this lecture is just to make the correlation between the ovarian and uterine cycle. You can see here both are 28 days duration. Uterine cycle is dependent on ovarian cycle. Uterine endometrium shows cyclical changes which are dependent on the hormones secreted by the developing follicles and corpus luteum. Now you can see the development of the follicle which is happening in the ovaries, and simultaneously you can see the uterine changes. So these are the basically correlations between them. Now this is the you can see the flow chart showing the hypothalamus produces releasing factor acting on the adenohypophysis of the pituitary gland to release FSH and LH, that is follicle stimulating hormone and luteinizing hormone. So they act on ovarian follicle and corpus luteum, and they help in ovulation too. So follicle stimulating hormone, it forms, you can say, stimulate the formation and maturation of ovarian follicle. Then ovulation it happens, and then the luteinizing hormones, they helps in the formation of corpus luteum. Now these are the changes which are occurring in the ovary. Now from these follicles, theca interna, we know it, the structure of the matured graphene follicle, estrogen is produced, which is affecting the post-menstrual and proliferative phase of the endometrium. And progesterone produced by the corpus luteum is affecting the secretory phase of the endometrium. So this is the correlation between these two cycles. You can see the changes in the hormone level, that is estrogen level is reaching up to this and reaching near the ovulation to the peak. Then progesterone level is more in the luteal phase. So in follicular phase they get the peak in follicular phase, that is estrogen hormones. And follicle stimulating hormone and luteinizing hormone, they are maximum at the time of ovulation, you can see, because they are stimulating the ovulation. Now, clinical correlation related with the menstrual cycle is amenorrhea, then it is the absence of menstruation. It is of two types, that is primary and secondary. Primary is that if the menstrual bleeding does not occur even after 16 years of age, then it is primary. Secondary is the stoppage of menstrual cycle with normal occurring menstrual cycle. Initially it was normal, but later on it stops, and that is, it may be physiological. That physiological is because of pregnancy. Pathological cause may be, there may be endocrine disorder, there may be ovarian or uterine diseases, there may be the effect of medication or any drug, then any systemic disease may affect the menstrual cycle. The abnormal menstrual cycle is hypomenorrhea, menorrhagia, oligomenorrhea, and metrorrhagia. So hypo is scanty blood flow, menorrhagia is profuse blood flow, oligomenorrhea is reduced frequency of menstrual cycle, that is more than 35 days duration of menstrual cycle. So metrorrhagia is irregular uterine bleeding. So this is all about the menstrual cycle. So thank you very much. If you like my video, kindly share it, comment it, and subscribe my channel, please. Thank you.